Morning, everybody. Welcome to the final seminar of the project called INHeRE, which stands for Inclusive Holistic Care for Migrant Victims of Sexual Violence, Capacity Building in Professionals, and Alignment of Policies and Practices. Let me guide you through the planning. First of all, I will do a small introduction about the INHeRE project, the consortium. We have the expert panel, the objectives, and what we already developed so far. Then we'll have a few keynote speakers, which we are very glad to welcome them. First, we'll have a keynote by Super Detective Sergeant Mrs. Bridget Cage. Then we also will have a keynote by our Belgian Secretary of State of Asylum and Migration, Sami Mehdi. We also have a keynote by Detective Chief Superintendent Mr. Declan Daly, and also of the European Commission by Policy Officer Christa Jacobson. Then we'll introduce different tools that we developed. We will start with the triage tool for victim identification and referral. Then we'll have the trauma-informed police interviewing techniques, and then a round of Q&A. We'll have a break about 10 past 11 until 20 past 11 Belgian time. And then we'll continue with two more sessions, one on the safe reporting procedure for migrant victims, as well as the massive open online courses that we developed in 8 modules. And then we'll have a Q&A again and policy recommendations, which we will ask you to formulate for us, and a wrap-up and closing. So we should be done by 12:50 at the latest one. So I will briefly introduce now the INHeRE project and its consortium. Migrant victims of sexual violence are in need of better care and safe reporting. Migrants, applicants for international protection, and refugees, so abbreviated as MAR, are extremely vulnerable to sexual victimization. This has been largely evidenced in former research that we have done, but also many others. Inclusive holistic care, that is what several international guidelines and scientific evidence has proven to be the most optimal care for all victims of sexual violence. Holistic care includes forensic, medical, and psychosocial care. Yet for a lot of MAR victims, access to this inclusive and holistic care is hampered by weak transposition of EU directives on minimum standards of reception of asylum seekers, which already dates of 2013 in several EU member states. But there's also the stigma for seeking help, especially in male and in LGBT+ MAR victims, and some specificities in MAR victims, as for example, language barriers, fear for deportation due to irregular status, and many others. Also structural barriers we see, for example, the lack of coherence between health and justice policies. Now, with our project INHeRE, we aim to improve care for migrant victims of sexual violence, and it's an EU-funded project by the program REC, which ran from November 1st, 2019 until the end of this month. And the general aim is to improve holistic care for migrants, applicants of international protection, and refugees who have been sexually victimized, regardless of their age, gender, sexual orientation, and legal status. The first objective is to build capacity and enhance culturally diversity competent practices of 5 key professional groups working with MAR through online and on-site training. A second objective was to align national policies with EU regulations and guidelines for safe reporting of sexual violence, regardless of legal status. And the third objective is to bridge competencies, practices, and policies across professions in order to streamline the care pathways. This means that we wanted to help people who are working with or who are in contact with MAR victims from detection onwards, or identifications, by helping them to better recognize signals and symptoms, and with the whole triage to identify which people might be in need of more care. And then we provided also trainings, and we developed tools for asylum reception facility staff, for police authorities, sexual assault center staff, interpreters and cultural mediators, and clinical psychologists who are providing that care to which you can refer more. This is not only at that time of acute care that is needed, but also for follow-up. So we also provided tools for clinical psychologists, sexual assault center staff, and interpreters, but also police authorities in the follow-up. So our first objective was to build capacity in 5 key professionals: police authorities, clinical psychologists, asylum reception facility staff, interpreters and cultural mediators, as well as other healthcare staff in sexual assault centers. Our second objective was to align national policies for safe reporting of sexual violence in Belgium, UK, and Ireland with EU directives, regulations, and guidelines. And the third objective was to bridge competencies and streamlining of care pathways in all those 5 key professionals, trying to ensure that optimal and inclusive care would be given to migrants, applicants of international protection, and refugee victims of sexual violence. So we have a very interdisciplinary INHeRE consortium. And first of all, in Belgium, we have Ghent University. So we are here at the International Center for Reproductive Health, but we also have the Center for Social Studies of Migration and Refugees at Ghent University. We also have the Belgian Federal Public Service of Health, Food Chain Safety and Environment, and BIOCI. In UK, we have NHS and the Sexual Assault Referral Centres of the Havens. In Ireland, our main partner is the Irish Department of Justice. And then at European level, we also have Victim Support Europe. So this is the main consortium. But we also had an international expert panel who helped and supported us through this 2-year project. We first have the European Federation of Psychologists Association, EFPA, the Platform for International Cooperation and Undocumented Migrants, PICUM, and then also the Belgian Equality Body and the head of a violence cell, the Institute of Equality of Women and Men. We used a participatory research approach to an implementation and community advisory board installment in each of the 3 countries. The purpose was to co-create everything that we did with the communities being affected by sexual violence and stakeholders in all phases of the project. We wanted to develop culturally appropriate instruments meeting the needs of all communities. In practice, this meant this implementation and community advisory board in Belgium, UK, and Ireland, which met at 5 decisive moments in the project to give input and feedback and to co-create. These ICAPs represented the targeted communities and also the key professionals. So we had police services like the police in Ghent, the Met Police in UK, and also in Ireland. I don't dare to pronounce this because I'm quite sure that I will pronounce it wrong. Medical and social staff of asylum reception initiatives, as for example, the Red Cross in Belgium, the Federal Service for Asylum, also staff from sexual assault centers in each of the 3 countries, intercultural mediation services, but also LGBT organizations and migrant support organizations in the different countries, as well as psychosocial support services for victims of sexual violence, as for example, Ruhama in Ireland. So the project resulted in the publication of good practice tool, so in the development and the publication of good practice tool for different professionals. First of all, we had the Triage tool for identification, care, and referral of migrant victims of sexual violence. And this was evaluated through a 2-round Delphi procedure by 42 experts, including, among others, experts from asylum sector staff, psychologists, and police officers. A second tool was the development and testing and validation of a good practice tool for police hearings, which was evaluated through online surveys and interviews with 45 police officers and 45 migrant victims of sexual violence and their representatives. A third system that we tested is an update of the video remote interpreting system for English-speaking care providers and interpreters. And we evaluated this through simulated interventions with care providers, with interpreters, and migrant victims of sexual violence in the 3 countries. And then finally, we also have a safe reporting framework for migrant victims of sexual violence, which we evaluated through focus group discussions and field testing with 27 migrant victims, 21 police officers, and 10 professionals working in sexual assault centers who all had an extensive expertise in working with MAR victims of sexual violence. So the project also resulted in the provision and publication of capacity building trainings. We developed and tested a massive open online course on sexual violence and migration, which comprised 8 online modules in English, in Dutch, in French, and Italian. And the English version was tested and evaluated with 143 key professionals from the 3 participating countries, but also from other European countries. And then we provided practice-oriented training of trainer sessions for key professionals who already followed that massive open online course, all 8 modules, and 53 professionals participated in this training of trainers. So 17 professionals working in the asylum sector of Belgium, UK, and Ireland, 12 police officers, 12 interpreters, and 12 psychologists of the 3 countries, and they now engaged in providing these trainings to their colleagues and other people who are interested with the same background. So first, I would like to give now the floor to our first keynote speaker, Detective Surgeon Kate Bridger. Kate is a detective surgeon who has worked with child abuse and child protection since 2001, managing and investigating serious crimes committed against children. And after 4 years investigating high-profile child murders, she is now managing a joint Metropolitan Police and Border Force team covering London's ports, tackling international child trafficking, slavery, and safeguarding. Mrs. Kate Bridger, please, the floor is yours. Okay, apparently there's a bit of a problem. This online things do not always work as we would like. So we will pass the floor immediately to our Secretary of State of Migration and Asylum, Mr. Sami Mehdi. So Sami Mehdi is, after being a board member of the Young Christian Democrats from 2015 to 2017, Sami Mehdi was elected president of the youth section in March 2017. In November 2019, he was re-elected as the only candidate in that position. From March to October 2020, Sami Mehdi was a member of the House of Representatives, succeeding Koen Geens, and since the 1st of October 2020, he has become our Belgian State Secretary for Asylum and Migration. Many thanks for joining this meeting, this final seminar. Please, Mr. Sami Mehdi, the floor is yours.
Thank you very much. I hope you hear me loud and clearly. Yes. Great. Well, thank you. First of all, I'm happy that my internet connection is working well and that you don't have a problem from my side. But it's a good thing that COVID is almost finished and that we can see each other physically. I think that would be a good thing. I would first of all like to thank you for having me here. I think it's an honor to have the opportunity to give some of my thoughts. And in this case, I would like to applaud the project because of the fact that the protection of migrant women against sexual violence and exploitation is extremely important. And it is something where we have to work together on several fields in politics. And often when you have a transversal topic and challenge, in politics, people tend to look to each other and not work together. While in this case, regarding this important topic, I really think that we need to work together. So we need to collaborate. There also needs to be a collaboration between different countries on this topic to make sure that we can enrich the outcome. Now, migrants are often vulnerable, and specifically migrant women are even more because of the fact that they can be victims of violence and they are in an extremely vulnerable situation. If they are here irregularly, they are often afraid to go to the police. And even if they have a legal status in Belgium on the basis of, for example, family reunification, they often are afraid to lose their legal status when leaving their husband, while at the same time suffering the consequences of violence. So a woman who is a victim of sexual violence or exploitation should not be afraid to go to the police. And that is our task as politicians, to make sure that they are not afraid, that there is trust. So training of frontline staff is most crucial in this matter. We know how important it is at the first contact, the first point where you can see an official. It has to be done in a proper way. So frontline staff should be able to identify signs indicating sexual violence and where to refer a victim to. Knowledge on the legal framework is also very useful to understand all possible consequences. Now, aside from identification and referral, it is important to know the concept of trauma and the impact this can have on a person's life. So the task of the frontline staff is the most crucial one. One of my staff members followed the online course and she was really impressed. It was not only interesting, but also very interactive. The videos really helped to outline the specific situation that was being discussed. Now, in my policy, I'm also working to increase the protection for migrant women in such a precarious situation. For example, there is a need of having a good relationship with NGOs. And I have already communicated to all NGOs that women who are irregularly in Belgium and who go to the police as a victim, that they will not be detained for forced return to their country of origin, which I believe is very important because it's difficult to go to the police in such a context when you are afraid of being returned to your country of origin. The Immigration Office will deliver an order to leave the territory at a specific moment. So we are currently looking into improving the form the police sends to the Immigration Office to avoid having misunderstandings and to assure the Immigration Office is at all times informed of the status of victim of the complaint. For the women who have a legal status, on the basis of family reunification, we will clarify and harmonize the procedures to strengthen their position when they become victim of intra-family violence. Now, FedAsyl, who is responsible for the reception of asylum seekers in Belgium, is also working on a training for frontline staff on human trafficking in general, together with the specialized centers, and sexual exploitation will, of course, be discussed and will be one of the major aspects of it. Under the direction of my colleague, State Secretary Sarah Schlitz, the federal government and the regional governments are working together on an action plan concerning gender-related violence, and attention is also given here to the position of migrant women with or without a legal stay in Belgium. So I'd like to thank you very much, and I hope to continue working on this important topic.
Many thanks, State Secretary Mehdi, for your intervention. And we have heard very well what you would like to do. So we would be definitely very pleased to support you in implementing all that. Many thanks. And we'll pass now the floor to EC Officer Christa Jacobson. She is a Policy Officer in the Gender Equality Unit of the Directorate General for Justice and Consumers of the European Commission. Her responsibilities include development and implementation of EU-level actions, policies on combating gender-based violence, managing a mutual learning program in gender equality, and supporting stakeholder engagement. She previously managed stakeholder engagement and European partnership development in the field of education and health at the Finnish regional representation in Brussels. And she also holds a master's in gender policy and inequalities from the London School of Economics and Political Science. Ms. Christa Jacobson, the floor is yours.
Thank you, thanks a lot. Morning from my side as well. And I want to start by thanking for this invitation to speak at this event. It's a really interesting project, so it's always good to be included in these events and learn more. So we know that gender-based violence is widespread across the European Union. It exists in every country, culture, or community, regardless of socioeconomic background. We also know that has a huge impact on victims' health and well-being, and it restricts their possibility to thrive in society and in education and employment. And despite progress in various areas of gender equality in the EU, gender-based violence remains a serious problem in all countries and communities, with, as I mentioned, serious physical, psychological, mental, social, and financial impact. We've also seen the numbers that 1 in 3, so 33% of women in the EU have experienced physical and/or sexual violence in their lifetime. And some groups are in particularly vulnerable situations, such as migrants and migrant women particularly. So violence against women happens everywhere. There is no safe place, not even at home. And the pandemic has really demonstrated how crucial it is to ensure that gender equality is at the center of our work. And we've seen how the confinement measures have also led to increased risk of domestic violence, as we have truly come to understand that home is not a safe place for everyone. So gender equality is a core principle of the European Union, but unfortunately it's not yet a reality. And tackling violence against women is a key priority for the Commission. And this was set out already in President von der Leyen's political guidelines, which stated that the EU will do all it can to combat gender-based violence and support victims and survivors. Our gender equality strategy sets out ambitious actions and policy objectives and goals to strive towards a union of equality. And this strategy consists of 3 pillars, of free, thrive, and lead. I'd like to tell you a bit more about the first pillar, so the free pillar, which explains the EU actions to tackle gender-based violence. So as stated in the strategy and also confirmed in the Commission work program for 2021, the Commission remains committed to the EU's accession to the Council of Europe Istanbul Convention on preventing and combating violence against women and domestic violence. The convention is a comprehensive and powerful legal instrument to prevent and combat gender-based violence and protect its victims. In addition, by the end of this year, we will also table a new legislative proposal to prevent and combat gender-based violence against women and domestic violence. And this initiative will have the same objective as the Istanbul Convention, which is to ensure that EU member states have effective measures in place to prevent and combat violence against women and domestic violence. The gender equality strategy also includes a set of non-legislative measures on gender-based violence, such as a recommendation on the prevention of harmful practices and the launch of an EU network on the prevention of gender-based violence. And the recommendation on harmful practices is envisaged to focus on the strengthening of public services, prevention and support measures, capacity building of professionals, and victim-centered access to justice. And we know that effective prevention of violence is key, and violence prevention focusing on working together with men and boys and addressing masculinities will be of central importance. So this involves educating, for example, the youth from an early age on about gender equality and respective and consensual relationships. And in this context, we will launch an EU network on the prevention of gender-based violence and domestic violence, which brings together member states and stakeholders to exchange good practices. And the work of these two initiatives, so the network and the recommendation on harmful practices, will start next year. In addition to these legislative and non-legislative measures, one of our key priorities is to continue funding organizations and projects working on the ground to tackle gender-based violence. We know that the funding plays a huge role in supporting victims and survivors and developing new actions to address gender-based violence and training of professionals and changing behaviors and attitudes. So it's always a pleasure to come speak at these events and see the results of the interesting projects taking place on the ground, because it really helps us to see some of the gaps and that we can possibly address them in our initiatives. And when developing and implementing actions and initiatives to tackle gender-based violence, we must ensure that groups which are particularly vulnerable situations and their needs are addressed. So we know that migrants and applicants for international protection and refugees are at a higher risk of sexual violence due to reasons linked to, for example, their legal status. We know that sexual violence is rarely reported, and access to support and protection services and to justice is often hindered by a broad range of barriers. So this is why new methods and tools and training to ensure a holistic care for the migrant victims of sexual violence are crucial. And the contribution of projects like INHeRE are incredibly valuable. So on this note, I would like to thank the Project Consortium for their work. And I look forward to the presentations and the discussion. Thank you.
Many thanks, Christa. We are definitely looking forward also to that network, which we highly support. That would be really great if you could work more internationally again on these topics, and also that what we developed in this project can be taken further to other European countries. That would be really helpful. Many thanks. And I now would like to give the floor to Detective Sergeant Kate Bridger from the Metropolitan Police. So she has worked within child abuse and child protection since 2001, managing and investigating serious crimes committed against children. And after 4 years investigating high-profile child murderers, she is now managing the joint Metropolitan Police and Border Force team covering London's ports, tackling international child trafficking, slavery, and safeguarding. Kate, the floor is yours.
Oh, thank you very much. The INHeRE project has been groundbreaking in so much as these three countries have come together and compiled a complete package in relation to sexual harm and migrants. The paper's written specifically the triage tool and the good practice tool called Sexual Harm and Sexual Violence for exactly what it is, and that is sexual abuse. They outline the significant harm, this not just being the visible harm and injury, but the hidden and deeply damaging psychological harm. They further point out that harm and risk of abuse at all stages for that migrant person. Abuse can be suffered in their country of origin, in transit, and sometimes on their long and multiple country or city, that journey. And then often the abuse does continue once at a migrant's destination. I mean, using the interviews and feedback from the service users in the police and law enforcement, and by this I mean, and also by the survivors of sexual abuse, The project has developed the good practice tool as a guidance for law enforcement officers. And this allows law enforcement personnel, such as police and immigration enforcement officers who encounter victims of abuse and exploitation, to have to hand that guidance and help and reference to best practice. And it's also got the tips, really, how to best engage and converse with those migrant or trafficked women and men that they encounter in their day-to-day duties. The good practice tool, that kind of goes beyond the knowledge and training that even the most specialist interviewing officers for victims of sexual abuse have, and much detail is paid to the trauma suffered, and advice is given how best a professional can recognize that trauma and work with that person. There's also kind of further guidance that's given in relation to other harms that a migrant or trafficked person may face, such as that servitude, the honor code, and the traditional spiritual abuse, all of these hidden and deeply harmful practices, and that are highly prevalent in some of the cultures that exist, I suppose, in the world. And there's also reference to the risk of people, even in marginalized groups and vulnerable groups such as LGBT, the abuse that they may face, the harm, the risk. Now, safe reporting. This is a highly complex issue here in the UK. The police and border force and immigration enforcement, we all work in silos, okay? The aim of police is to bring to justice offenders. For border force, that's to protect the borders, and their immigration enforcement colleagues, their aim is to reduce the size of the UK's illegal population and threat that illegal immigration presents. Safe reporting as defined in this project would require significant law change here in the UK. There are, however, policies in place that allow witnesses in legal cases, in criminal cases, in civil cases indeed, to remain legally here in the UK until that case has concluded. And I was also made aware of some surgeries that are held across the UK by immigration enforcement that assist immigrants with illegal status to return to their country of origin only if it's safe to do so. And this is all in addition to the UK process and protocol for seeking protection or asylum here in the UK. So, you know, I've worked on this project for a couple of years now. I've been honoured and I'm very grateful to have been part of it. And I look forward to sort of extending my knowledge and teaching the good practice of this project to my colleagues. Thank you.
Many thanks, Kate, also for providing your appreciation for the different tools we develop, but also for pointing out the challenges still laying ahead in some of the implementations, especially regarding the safe reporting. And I think the challenges you pointed out are not only there for the UK, but also for many other European countries. So thank you very much for your intervention. And I would like now to give the floor to our last keynote speaker from Ireland, Detective Chief Superintendent Declan Daly. Detective Chief Superintendent Declan Daly is the Bureau Head of the Garda National Protective Services Bureau in the Irish Police. This is a national unit which was formally established in 2015, and among others, the Sexual Crime Management Unit and the Human Trafficking Investigation and Coordination Unit fall under the leadership of Mr. Daly. Declan, the floor is yours, and thanks already in advance.
Thank you very, very much. And thank you to, I suppose, firstly to all the people who are involved in the project. I have to say it's a very impressive project. And also a big thank you to all the participants of this seminar today. Very, very important. The training that I think this will deliver will assist you in your roles into the future. And more importantly, it will probably and most certainly assist victims. And I think of building on what previous speakers have said, and I support what they have said, is I'm a police officer for 32 years, and I suppose for the vast majority of that time I've been involved in crime detection. And when I first started, you know, detective work was reactive, mainly reactive, There was no DNA. There was no phone evidence because there was no mobile phones. There was little in the way of research done in relation to crime, and there was very, very little involved by universities or other outside state agencies. Or if it was very, very rare. And we were worse off for that, certainly. And thankfully, things have changed. As police officers, we are certainly more victim trauma informed, which is really important. We're more open to research. And this benefits us and it benefits the victim without hesitation, I would say that. We are less reactive, and projects like INHeRE give us as police a more proactive edge and a better understanding of the victim. And I think understanding the victim is very, very important. Because if you can't understand your victim, then you cannot deliver that police service to them. And this seminar, this project, delivers exactly that. It delivers, I think, an understanding of the victim and the specifics of, the migrant victim and their vulnerability. The trauma experienced by victims of sexual violence, regardless of their background, can't be understated. They carry that trauma for life. It's likely that it's not visible to many, but it is there. And I suppose, having been involved in victims and sexual crime investigation for a very long time, without stepping into their shoes, what I would say is, if you can imagine what it's like, the trauma, how I describe it is that, imagine walking around a city carrying 2 heavy suitcases all day, and it's tiring, and your arms are sore, and you're weakened by it. That is what victim trauma is. And they're simply looking for some way to let those suitcases down, those heavy suitcases down, and get some relief. And that's what trauma is about. And now, as police officers, what we cannot do is we cannot add to that trauma. That's very, very wrong. So we have to be very careful in how we deliver our policing service. Okay, and how we do that is through projects like INHeRE, which will deliver great effects and great improvements. Language, culture, they're all other areas which impact on trauma and which make it much more difficult for the experiences of the migrant victim. Vulnerability is fluid. So somebody may, who in their normal life, may have no vulnerabilities or very little vulnerabilities. If they go to another country, and they're the victim of a theft or their phone stolen, they can suddenly become very vulnerable, even for a very temporary period of time. There's still a vulnerability there, and I think we need to hold that in our minds in terms of dealing with migrant victims. The work done by the INHeRE project highlights, I think, the challenges that migrant and refugee victims face, particularly the victims of sexual violence, their fears of deportation, mistrust of the police, exposure. They try to live, a hidden life. Sexual violence, the risk is exposure, and what we see time and time again, the choice that they have to make. Do I report, or do I just suffer the abuse and hold my quiet life? And that really has to be. We have to fight that. We have to work hard to make sure that we counter that and we combat that. I think it's very, very important, I suppose, that that the tools that have been developed here, they will help us and they will support us. The guidance document, the good practice document, and the triage tool are designed, I think, to give us that, as I said, that proactive edge. And I would encourage us as participants to use them and to familiarize yourselves with them, so that you can use them in the course of your duties. And I suppose finally, just to thank all involved again in participation and the development of this project. It's a very, very significant project in terms of value for policing, and I think into the future it will deliver a better service to victims. Thank you very much.
Thank you, Declan. Thank you very much for this intervention. I think you touched upon several of the aspects of the project, not only for the police, but as you said, we cannot add trauma. I think that's very important indeed, not only for the police, but for all the people that are involved in the detection of sexual violence in MAR victims, over the people who provide care, if it's at the asylum reception center, at the first encounters with people they have, as if they can be referred to services as the sexual assault care centers, but also the long-term follow-up care by psychologists and indeed the police, if the people, if we can stimulate them to report and then have also a safe reporting, that this should not hamper or provide a secondary victimization to, as you said, the baggage they already carry, that we can help to recover of sexual violence later on. So many thanks to all our keynote speakers for your interventions, for all your support. We also definitely heard your appreciation for the project, for which we thank you greatly, but also the plans you have or the challenges you see. So we're very eager to continue collaborating on that. And I think the rest of the day will also help us to make that, to pinpoint that, to make it this more a bit concrete. So I'd like to give the floor now to Leni Lindhout. Leni is my first line colleague here at Ghent University ICRH, and she has a master's degree in social work and social welfare studies and finalizes an advanced master in European integration. Over the past 2 years, she co-coordinated with me the INHeRE project. And she's also now started a PhD on male sexual victimization of migrants. We've heard already today that, and several of the keynote speakers, that female migrants, applicants of international protection and refugees are at risk of sexual victimization, but also a lot of male migrants are at risk of sexual victimization. So Leni will also continue studying that, and also based on what she learned in this project. So she will now introduce the triage tool for identification, care, and referral of migrant victims of sexual violence at the European Asylum and Accommodation Initiatives. Leni, the floor is yours.
Thank you very much, Ines, for introducing me. And as she said, my name is Leni, and today I'm going to present you the first tool that we developed in this project. So the triage tool, specifically designed for staff working in asylum reception centers. So first of all, why was this tool needed that we developed it? Well, as Ines already elaborated on, the need for this project has really its roots in practice and in the needs of professionals in the field, as well as in the outcomes of previous studies, which showed us that sexual violence often goes unnoticed or unidentified, let alone disclosed or reported in asylum reception centers. And at the same time, we see also in studies that the different professionals working in these services could really play an important role in the recovery, in caring for these victims, and the eventual referral of victims to specialist services. But these professionals really express the need for clear and structured tools, instruments that could assist and guide them in taking decisions about victims, and also or to co-decide with the victim together what to do, how to care for such a victim, and how to refer this victim. So therefore, because of these needs that were active in practice, we decided to accommodate to this need by including it as a key outcome of this project. And how did we start to develop the tool? Well, it's a tool developed in different stages. First of all, we collected the different literature that's already written on identification and caring for victims, as well as the different existing tools and instruments that were already available in practice and on the internet. And then based on the first identification and a mapping of existing tools and literature, we made a first draft of how the triage tool would look like. And this first draft was then subsequently commented by the relevant stakeholders of the implementation and community advisory board. After them giving input, we set up a 2-round Delphi procedure by collecting the opinions of experts on that topic and through sequential surveys. But I will briefly introduce you to that Delphi procedure in a minute. And then based on the input that we got from the Delphi procedure as well, we finalized the tool and we translated it in 4 European languages: English, Italian, French, and Dutch. And then the final version was ready for dissemination to all of you. So what is a 2-round Delphi procedure? Well, we included the opinions and the feedback of a panel of experts via a 2-round Delphi procedure, which aims to reach consensus on a specific issue. Here it was the content of the triage tool and what different elements should be included, what information is necessary or relevant and which not. And we did this by sending out 2 sequential surveys to relevant experts. Here the experts were staff working in accommodation centers, clinical psychologists, police officers, staff working for migrant support organizations, NGOs, as well as staff working in sexual assault centers. And these experts completed 2 surveys during over a time frame of 2 months. And we tried to reach consensus on the content of this tool. And just to give you an idea, for the first round, we gathered the opinions of 42 experts. And for the second round, we had a lesser response rate, but still 31 experts responded to this survey, which was very informative for us to further build the triage tool. Okay, so and then last summer, including all the feedback that we gathered, the tool got finalized and translated in 4 languages. So there is one in English, in Dutch, in French, and in Italian. The tool is free available on the website of icrh.icrhb.org. And if you then go to the page of the INHeRE project, you can find and download the tools, which is also the case for the other tools and the trainings. Now, very briefly, how does the triage tool look like inside? Well, basically, it consists of the following 5 chapters or sections, like you want to call it. And I'll briefly guide you through each of them in the following slides. So a first section is called Sexual Violence and Migration, and this section is quite theoretically. The aim of this chapter is really to provide the necessary background information on sexual violence, and then sexual violence specifically in a migration context. So professionals are aware what sexual violence is, what the consequences are, what the prevalence is, and they get acquainted to good practices regarding caring for victims, what to do and what not to do, etc. So very informative section. The second section includes then 2 triage sheets, which really together with the care pathways forms the basis of this tool. The first triage sheet can be used by any professional working in an asylum reception center, and the second sheet can be specifically designed for medical professionals. How come, would you ask? Well, as you can see here, this is a screenshot of how such a triage sheet looks. Well, we included indicators or cues situated on the different aspects of a person's life. So for instance, here it's the nonverbal communication or below changes in daily behavior. And these indicators may alert professionals to consider the possibility that someone has experienced sexual violence. It is important for professionals to carefully assess each time on an individual basis and at different points in time whether indicators who are present in an individual could eventually be linked to sexual violence or not. So for the first triage sheet, we included different indicators regarding nonverbal, verbal communication, changes in daily behavior, but also contextual factors. And then for the medical professionals, we included indicators regarding the mental health, physical health, sexual and reproductive health. It's very important to know that this is by no means a diagnostic tool, but it really has the function to guide professionals who are not in first instance quite familiar with sexual violence, to take into account several aspects of a person's life, so to have a comprehensive view, and to take into account these aspects that at first sight might not be seen to directly relate to one another or to sexual violence, but to take into account that it can be possible that that person experienced sexual violence, and to follow up if needed. A third section, these are 3 care pathways, like where I briefly touched upon before. So these care pathways and referral pathways aim to guide professionals in taking proper action and refer a victim if needed. They are very practical designed, and they aim to guide professionals step by step to take action and to decide at important decisive moments in 3 scenarios. So first, to take action in case of reasonable grounds to presume sexual victimization in a person. Secondly, to take action in case a victim discloses sexual violence. And thirdly, in case that a professional witness him or herself an act of sexual violence. And here as well, there is a screenshot of how such a pathway looks like. You can see it's very clear-cut designed step-by-step approach. And the actions that we advise or recommend to professionals are really formulated as clear-cut as possible. So, so they can follow this, taking, of course, the reality into account, but that they can follow this step by step and act properly. Excuse me. The 4th chapter are management guidelines of an asylum reception center, as we are convinced that well-designed asylum reception centers may contribute to the prevention and the reduction of sexual violence in the first place. And to give you an idea how it looks like, here is a screenshot. So it includes a short checklist for professionals as well as for the management team to assess their design and the organization of the accommodation service they work in. It looks at the physical space, but also on the training and the supervision in place, and the protocols and the practices who are implemented. And ultimately, the 5th final chapter includes a list of referral services and its contact details. There is such a list for Belgium, for the UK, and for Ireland, so the 3 partner countries, as well as a small section on Italy as well, as the tool is also available in Italian. So it includes contact details and referral information on sexual assault centers, but also on interpretation services, services for victims of trafficking, services for victims with other specific vulnerabilities, as well as legal services. So this was my last slide, and we eagerly invite you, of course, to have a look at the triage tool yourself. And if you find it interesting to use it in your practice and disseminate it in your network, we also welcome any feedback that you might have while using it or that might come up afterwards. So after the project, Professor Keynote and myself, we are still reachable to receive your feedback via our email addresses, which also can be found in the introduction of the tool. So thank you very much for your attention and enjoy the rest of the seminar. I'll give the floor back to Professor Keynote to introduce the next speaker. Yeah.
Many thanks, Leni. For the people who would already have questions, please hold back for a while. We will first introduce the second tool, the good practice tool for police hearings with MAR trafficked and LGBT plus victims of sexual violence, which will be introduced by Silvia La Monaca. And after that, from Paioki, and after that, we will have time and room for questions. So Sylvia Lamonica is the head of the programs at PAYOKE, that's an Antwerp-based reception center for victims of human trafficking and anti-trafficking NGO. For the INHeRE project, she was the lead author of the Good Practice Tool for Police Hearings and co-author of the massive open online course module on human trafficking. Dear Sylvia, the floor is yours.
Thank you, Ines. Trying to get my PowerPoint started. First of all, maybe Talala, you give me access.
Sylvia, we can't hear you.
Can you hear me now?
No.
Is that okay?
Is it in order? All right, okay.
Okay, people.
Go ahead, Sylvia.
I'm getting thumbs up. I need to share my screen, Ines. I'm trying, but it says perhaps you have to shut off your presentation there. Okay. All right, here we go. So again, you've got the title here, and I have to say we already had some very good introduction given by Declan and Kate and Mrs. Jacobson of what are the main elements of the police tool. And so I don't really want to repeat what has been already said. So I'll try. I'll pick the slack off from what Declan said about. He said if you can't understand the victim, you can't deliver a service, and that's really at the core. That was the concept at the core of our research. So this tool, if we go and look at the purpose, was really designed for police officers who wish to introduce a trauma-sensitive approach into their practice, and that means that we aim at a win-win situation where law enforcement feels that they have gained valuable elements to support their investigation, and the victim feels that they have been helped to access their rights. And this is why we say the approach was based on human rights, was victim-centered, and was trauma-informed. Now, coming to the methodology, we used two main sources, which were the clinical journals from our director and from the PAYOKE social work teams that serves victims of loverboy trafficking. On the other hand, we had consultations with the police officers that work in close cooperation with PAYOKE. And here I refer back to what you, Ines, said about co-creation. So we really wanted to start with materials that police officers already use in their daily work. So the clinical journals laid the foundations of the research, which is connected then to the main concept of trauma theory, and this formed the basis. This was all reflected in the first part of the tool. On the other hand, our colleagues from Belgian law enforcement gave us a model, a 10-step plan for police interviews, which is an iteration of the PEACE model that we used to develop the second part of the paper, where we illustrate a trauma-informed interview model that is streamlined into 7 steps. And then, of course, we had several rounds of validation through Delphi procedure that Leni talked about, questionnaires and focus groups and simulations with the different target groups. The paper, the first chapter of the paper is called Understanding Trauma. And this was our starting point because we asked ourselves the question, what all these groups have in common? And the answer, what is the common denominator? And the answer was, most often, all victims of sexual violence experience trauma. And we also emphasized the fact that individuals respond differently to traumatic events, and that there's a broad spectrum of possible conditions and comorbidities resulting from trauma. So we can talk about PTSD. There's a complex PTSD, especially in the case of trafficked persons. There can be other diagnoses, other conditions, or no conditions, no consequences at all. However, where those conditions exist, they can affect the way a person behaves, their ability to regulate their emotions and reactions. And trauma symptoms can shape a person's sense of self and others by generating feelings, for example, of shame and mistrust. And all these symptoms sometimes translate into behaviors that are puzzling to a police officer. Imagine a victim that is defiant, that is aggressive, or provoking. This person does not show the ideal context that we would expect from a crime victim. And this gap between the ideal victim and the behavior exhibited by the complainant that the police officer is interviewing, in some cases can bring to a change of attitude in the interviewer, and then trigger a chain reaction of just misunderstanding and miscommunication. And in this scenario, the protection of the victim can be jeopardized, and so is the successful outcome of the interview. So a trauma-informed approach to police interviews at the end aims to create an enabling and safe environment for the victim to disclose and help the police officer to distinguish between unwillingness to disclose and inability to do so. Chapter 2 of the tool goes over the specific vulnerable groups that we have targeted with this tool and the most common barriers to disclosure. We do not describe all the barriers to disclosures, but only those that are relevant in this context. Evidence from EU-wide surveys indicates that most victims of sexual violence do not report either to the police or to any victim support organization. And this paper describes the barriers. As I said, it goes in details about the barriers for each of the groups listed. But if we look at the barriers across the board, there are some most common that came out. For example, the fear of being blamed, or the fear of stigma. And this really refers not specifically to care workers or to police officers directly, but it's the fear of being blamed by family and friends primarily. And it's interesting, it's very interesting because one study apparently found that victims report feeling better off receiving no support at all than receiving reactions that they consider to be harmful. Another common barrier is self-blame. Then we have limited knowledge of available support, distrust in authorities, and fear of not being believed. Sometimes this is associated with what we call offender strategies that particularly applies to trafficked persons, because it refers to the case where, for example, the trafficker manages to convince the victim that the police will not help them if they escape. Safety and protection concerns is another common barrier. People ask themselves, what if I go to the police and they cannot protect me? And this is often in association with a fear of retaliation. The inability to label the abuse as a crime. Sometimes this very often happens, for example, with victims of lover boy trafficking. The victims cannot label themselves as victims. They do not recognize themselves as victims. There's also specific barriers to the MAR group. There are, for example, fear of deportation, language limitations, religious beliefs, and this is also true for trafficked persons, if you think of the voodoo, for example. In the next chapter, we we delve a little bit deeper into interviewing techniques, and we offer tips about recognizing and responding to specific behaviors that complainants may exhibit. And these behaviors are grouped into 4 clusters that can be described as emotional dysregulation, which happens when people are unable to properly manage their emotions. Dissociation, when that manifests itself when the person struggles to be present. Alteration in self-perception that can translate into self-blame, low self-esteem, or quite the opposite, when the person tends to behave as an offender. Alteration in social interaction, such as distrust, seeking confirmation, or in contrast, appearing overconfident. And for every cluster, we describe the behavior and emotional cues that the person may show, and we give some tips in the form of do's and don'ts, so very practical. Then we offer an analysis of the most common credibility challenges that victims may face in a police hearing. Again, we don't list all the credibility challenges, but only those that are relevant to this context. And again, these are really linked closely to the stereotypical image of the victim. We go back to the notion of the ideal victim. So the ideal victim is the one that always has a coherent story. And here in the paper, we analyze, we go back to trauma theory and see how trauma has an impact on memory and on the victim's ability to organize their thoughts and communicate. The ideal victim also always fights back. And in the paper, we illustrate how those who report little or no physical resistance are often viewed with suspicion. The ideal victim also reports right away. And here we try to break down this stereotype and look at how people sometimes need time to report because they need to feel strong enough to do so, or because they need to process what happened to them, or may fear retaliations, or they need more information, or so many other reasons that may delay the reporting. The next chapter offers guidance as to how to create a safe and enabling environment space, which is really at the core of a trauma-informed approach to interviewing. So we look at the physical environment where the interviews the interview takes place. For example, in Payoki, it's very common for the police and the victim to meet in Payoki's kitchen. So where the way the space is arranged, where you put the table, where you put the chairs, the way the police officer presents himself in uniform, not uniform, the choice of the gender of the police officer. Then we go over interpretation, appropriate interpretation. The interpreters need to be carefully selected. They have to remain independent. They have to be informed beforehand about the content on the interview to make sure they feel comfortable talking about those topics. The police must ensure that there's no conflict between the interpreter and the victim, in the sense that there's no that they are culturally compatible, for example. So this is to say that the fact that the two persons speak the same language sometimes is not enough. And then we go over what it means to adopt a victim-centered approach. In Payoki, we usually refer to the 4 C's, which are confidentiality, control, cooperation, and consent. And then finally, in the last chapter, and the last part of the tool, we describe the 7 steps. The 7-step plan, which illustrates a possible victim-centered approach to interviewing. So the first step is engaging. Engaging is a phase where we try to reduce the anxiety that may be connected with the interview, and build rapport and connect with the victim. And this step also includes responding to any needs that the person may have, addressing their safety concerns, and providing appropriate referrals. For every step, we give a list of questions that the police officer can ask. For example, in this case, it will be, do you have any concerns? Is there anything you need to do before we start our conversation? The second step is called explaining. So here, the police officer will illustrate what is going to happen and outline the framework of the conversation to create an atmosphere in which the victim will feel comfortable to talk and to share. So he may say, I will speak to you and my colleague will note down what we say, because we also explain the rules of the game. And another, for example, I'll give you another example of a possible sentence. If I asked you to explain or clarify something, it's not because I doubt you, but it's because I need more information to better understand. The third step is breaking the ice, and it's really fine-tuning with the victim. In this case, we recommend that the officer starts with a neutral or light-hearted subject to break the ice. And in this phase, the 2 persons will take time to, we will use this time to get comfortable into the situation, to get used to the tone of voice of the other person, to the presence of the other person. And the officer may also use this time to assess the complainant's reactions, their concentration levels, and their ability to answer questions. Then we have eliciting a free narrative. And this is really a crucial point in the hearing. One study shows that law enforcement interviews of sexual assault victims reflected an average of 4 interruptions for each victim response. So we really stress the point that it's crucial for interviewers to avoid breaking the victim's train of thought in order to obtain an accurate and reliable account of the events in a non-suggestive way. And the free narrative is very often solicited with open prompts. For example, where would you like to begin? Then it goes on to clarifying and completing the free narrative by way of briefly summarizing after the account and before going into questions about the specifics. For example, can you tell me more about, or do you recall hearing anything? Do you recall smelling anything? Next step will be review, follow-up, and evaluation that allows the victim, to check that the account has been accurately recorded or understood, and the officer to evaluate whether the objectives for the interview have been achieved. So the officer or the officers, the team, the investigation team will ask themselves, have we asked all the questions we wanted to ask? Are there conflicts to be resolved with evidence that have been previously collected? And the final step will be thanking the interviewer for their time and effort, and not for the content of the interview. So this will be the end of the paper, and thank you very much for your attention. If you have questions, we're here for you. Ines, back to you.
Well, I'll take over from Ines. Good morning, everybody. I'm Saar Baert from International Center of Reproductive Health, and I will guide this Q&A session. So thank you, everybody, for your excellent presentation. So I would like everybody now to, we have 20 minutes for questions. So if you have any question, there is a Q&A button on the bottom of your screen, and you can actually address any question you have in the Q&A, and then I will take your questions and direct them to the person who can answer these. Yeah. So I invite everybody to put your questions there, or if you can't find it, you can put them in the chat. We do have a first question here from MT Lee, so her question is, as this is a 3-country project, may I ask what results might be expected, or what might be your expectations for a good outcome from this project? So I propose Professor Kenyard maybe to answer this question.
Okay, thank you, Sarah, and also thank you for this question. I think so far, we although despite the COVID times and the very difficulties to get our project really done in time and meet all the deadlines, I think I'm very glad and also proud of our consortium that we managed to meet all the deadlines and that we managed to develop all of the tools that we wanted to develop. So I think that was already our first goal, to make sure that we could develop and test and validate those massive online open courses, that we managed to provide training of trainers to those 5 key professionals, although we had to do that all online. And also the triage tool that was tested, the safe reporting framework, the policy appraisals that we have done, and other things. So as thus far, I think that that's already a first outcome, which we're quite proud of, that all the publications are there, not only in English, but also in Dutch, French, and Italian. Of course, there's a challenge now to get it all implemented in the different sectors. And although we have quite some engagement of the 5 key professionals, groups, and sectors, Already, of course, it needs to be implemented in a more structural level, maybe, so that needs also some engagement of management level, or also at policy level, especially for the safe reporting procedure, to get that, also the trauma-informed guidelines that the police can use it. So I think the first challenge is to make sure that this is implemented in the 3 partner countries, in Belgium, UK, and Ireland. But also, even a better outcome would be that in the end, eventually, so not during this project, which only runs for another month, but post-project, that we can also make sure that these tools are getting disseminated all over Europe, and that also other European countries can benefit from this project within those 5 key professionals. And then I think if we can even hope a bit further, it would also be nice if other key professionals could benefit from this project. But I think at the end of this session, when we have our policy recommendations, these are also questions that I would like to turn back to you, so you can already maybe start thinking about that. What possibilities do you see if you work in other countries? How can we make sure that this is implemented in Belgium, in UK and Ireland, but also in other European countries, but also in other key professionals? So please bear this already in mind, and all the suggestions you might have, we will come back to it, and then you will be able to share your thoughts with us, so we can also learn from you. I hope this answers this question. So Saar, the floor is back to you.
Thank you, Ines. Then we go to the following question from Lieselot Kastelein. She's asking, well, she's first of all thanking everybody for the interesting and valuable project. And she is wondering if the online courses are still available and where they can be found. So we'll talk more about this later on in this session, but maybe my colleague Leni can already answer this question.
Yes, thank you, Saar, for the question, and thank you, Lieselot, as well. We have tested the modules. Raquel will, my colleague Raquel will in a minute tell you everything about this, but we included all the feedback that came out of this pilot testing, and we translated also the modules, and these are going to be finalized still this week. I guess that the Dutch, the French, and the English version is already available, and we're putting an infographic on the website of ICRH in order to access these courses and to register for them. But the Italian version will still is still hanging on. This will be finalized by the end of this week. But the infographic to access the courses will be shared on the website, and I can already put it in the chat. But by tonight, this infographic should be online, and the course should be available for you. Thank you.
Thank you, Leni. Then there's a question if this project could be rolled out in England, in London. So Ines already added a bit to that, but maybe Raquel Correa is willing to add a bit more to the rollout of this project in London specifically. Raquel?
Hello, can you hear me?
Yes.
Yeah, so kind of in the Havens, the Sexual Assault Referral Centre for London was one of the partners in this project, and we involved many clinicians and staff members from police, NHS, third sector in the project, and we got feedback from many staff members in our modules, also the triage tool. So I guess kind of we have involved a number of professionals and really cascade invites to our ICAB meetings. And the plan is, of course, to continue building on the work that has already been done. In particular, I'll be talking a little later about the training of professionals. And in UK, we trained psychologists in particular, but also we trained psychologists in Ireland as well as Belgium. And there's going to be, there will be also doing trainings. So, but I'll go into more detail about that. I guess kind of the MOOCs are going to be available, so the online modules, and they are going to be widely available. So those of you who are not able to do the e-learning modules, you know, they will be freely accessible, so that you know, you can familiarize yourself with all the information and learn about work that has been done, and good practice in working with this client population. I hope I've answered the question.
Thank you, Raquel. Then there is a next question from Stella Okungboa, who asks, is the project already operational in Italy? And if yes, which organizations are working on it, and how can they be contacted? Maybe Sylvia, would you try to give an answer to this question? Sylvia Lamonaca?
Yes, the answer is that Italy was not, there was no partner from Italy officially. So in this sense, there is no organization in Italy that is directly involved, was directly involved in the project implementation, but we translated, Leni, correct me if I'm wrong, I think we translated all of the main outcomes, all of the main publications into Italian, so they should be available on the website of the project, also on our website, and I suppose on all the partners' websites. And that includes the training.
Thank you, Sylvia. Then there is another question from Pascal Rilov, who is asking, is the training package available to and adapted for interpreters? And is there anything that still needs to be done for interpreters to get proper training? Maybe I would like to invite Hans Verrept to answer this question. Hans, are you available?
Yes, there's a small problem with the camera. Yes, well, the package that was developed is available and could be used for interpreters as well. There were some interpreters who have participated in the training in Ireland, in England, and also in Belgium. So this is readily available. Yeah.
Okay, Hans, I see there's another question on interpreting from Kate Deglish, so maybe you want to cover that as well. She's saying, I'm an interpreter, so completed the training for interpreters. Up until recently, the victims I dealt with were people I had never met before, but one of my regular clients disclosed and found it affected me in a different way than all the others because I know the individual. Are you going to include that type of impact on health and allied professionals?
I think it was an important point in the training we gave that as an interpreter, you have to be aware of the possible impact of working with victims of sexual violence, and that you should, I mean, if you yourself have been maybe a victim of sexual violence or in any other way, this might touch you so badly that it would affect your mental health or your health in general, that it might be wise not to accept the actual this kind of intervention. And what we also stressed in the training is that afterwards, after you have done this kind of an intervention, it may be important to look for help if you need it. I mean, maybe see a psychologist, because even during the role plays we did, during the training, we found that people were very much affected by these, although everything was fictitious. So these are really important points, I think, that interpreters and intercultural mediators should be aware of and should take into account to be able to function well and to remain healthy.
Okay, thank you, Hans. And as Ines is sitting next to me here, she proposes to intervene on that question as well.
Yeah, thank you, Kate, for this question. I think what the question you raised is something that counts for all people who are working with victims of sexual violence, and especially with MAR victims of violence. That's why in the MOOCs, we tried to provide some attention to that, how you can make sure that if you hear all those stories of victims of sexual violence, how you can make sure that you stay healthy as well and that you can continue coping with it. That's why we also suggest or highly recommend that people who are working, and if you're now in an interpreter or in a sexual assault care center or in the police, that intervision and supervision is foreseen. So you can continue working with victims and provide support, but yeah, it is really needed to have that support from other colleagues as well, and to have intervision and supervision if possible as well. So that's highly recommended.
I would like to add one small thing. I think the fact that many interpreters, in particular in the UK and in Ireland, are working as freelancers puts them at a high risk. And what I found when we were talking to care providers in Ireland and in England and also in Belgium is that sometimes when they get an assignment to interpret, to do an interpretation, and they don't even know that it will be for a victim of sexual violence. So this makes it very difficult to manage this kind of situation and also not to accept this kind of an intervention. So these are things we should really look into. I think it's very important.
Okay, thank you, Hans and Ines, to respond to this question. I also see that some people put some maybe interesting resources on burnout and vicarious trauma for interpreters in the chat. Then I see another question here. Are the tool from Elizabeth Palmero, who asks, are the tools also adapted or adaptable to workers who work with children and unaccompanied minors more specifically? Raquel, maybe would you want to answer this question?
So is the question around the burnout and vicarious trauma tools, whether they are adapted for those workers working with children? Is that what we are being asked? I can't hear you, Sarah.
Yes. Yeah, the question was not specific. I assume the person is talking about the tools in general, the triage tool and the police hearings, but I invite Elizabeth to clarify that maybe in the chat if that would be a misinterpretation from my side. It was not specific. Elizabeth said it was not specific. So in general, are those tools adapted to work with children and unaccompanied minors?
Some of the tools can indeed kind of be adapted with regards to vicarious trauma and burnout. There's a lot of overlap. So we are kind of working with a population presenting with complex needs and have been exposed to a number of traumas. And as it has already been said, it's really important that we attend to our own self-care. So it is crucial that we try and access supervision, and sometimes we may even need to access perhaps therapy ourselves when we realize that the work with this client group is affecting us. So it's really important to be able to reflect on this work, and as Hans said, perhaps thinking about current practice and changing current practice, because I think it's really kind of, you know, really hard when an interpreter gets an assignment and goes completely blind into the assignment, because we need to think about the statistics in terms of women and men who have experienced sexual violence, and as we know, the interpreters themselves may have experienced sexual violence themselves, so it can be really hard and highly triggering, you know, to be in the room with a victim of sexual violence, which can obviously kind of impact their mental health and actually their ability to even be present and interpret in the best possible way. So that's kind of in terms of the vicarious trauma and burnout. With regards to the triage tools, they can be adapted, and I don't know whether Leni may want to add to it, as she was kind of one of the lead authors on the triage tools, and kind of, I think, you know, they are quite comprehensive tools, and you know, presentation of trauma in children and young people may present slightly different from how an adult might present with trauma and PTSD symptoms. So always important to kind of, you know, familiarize yourselves. In some of the modules of the MOOCs, you'll see there has been particular attention being paid to younger victims of sexual violence in the context of migration. So would really encourage you, even if you have already gone through the online modules, it's always good to refresh your knowledge. I find that usually second time round, you know, I watch kind of a training event, kind of, you know, I'm able to perhaps, you know, retain a lot more information and really link theory to practice, but it's certainly covered in some of our MOOCs. Thank you.
Thank you, Raquel. So I'll invite Leni to see if she has anything more to add on children and the use of the triage tool.
Yeah, thank you, Sarah, and thank you, Raquel, for this elaboration on this question. Specifically regarding the triage tool, we included also experts through the validation process, working with young people and especially also with children. So their input on the triage tool is also included. And very concrete, we also included a box in the triage sheets, which includes indicators or cues specifically targeting or specifically for children and unaccompanied minors. So of course, professionals working with these groups can make use of the triage tool. And also in the final chapter for the referral context, we included a list of services to which specifically children and unaccompanied minors can be referred to. So I think that's the yes to your question.
Okay, and I thank you, Leni. I see that also Klaus van Houten wanted to respond something to the guidelines on minors. So maybe Klaus, do you want to elaborate on that? Klaus, yeah, hear that Klaus is actually unable to put his microphone on, but then maybe I'll just summarize his
can you hear me
in
now?
the chat, where he said that actually the guidelines are partially based on programs for video hearings for minors and their own experiences within PAIOKE with minors. So yes, those tools are absolutely adaptable. Then I have another question from John Monroy, who says it is very important that politicians and the police authorities in every country get involved in the project, which was empathized by a few of the keynote speakers. And to continue in this movement, what is done from the project to prepare and sensitize those politicians to welcome victims? So I'd like to invite Ines to answer this question.
Thank you. This is not such an easy question, of course. I think that within the participatory approach we used in this project, this community this implementation and community advisory boards that we had in each of the 3 participating countries, we also involved policymakers at different levels, at national, international level as experts as well, but at national level, regional level, local level, depending on who has the competences to be able to decide and improve and implement the tools that we develop. So they are already there. And after this seminar, we still have 2 days of the consortium meeting where also the members will be present, and where we will think about how can we make sure now that this implementation is done, and that policymakers, not for those who are not aware yet of what we made, how can we make sure that they come to know everything that we have done, and then how can we do some advocacy to make sure that they are also implemented, and where needed, that debate is done with the policymakers to also change policy. A big part of what we did was on policy appraisals and working with policy, especially for the safe reporting. And we also have in our expert panel, PICUM, for example, who is closely working and advocating and lobbying with a lot of, and also Victim Support Europe on how to make this happen. But this afternoon, we also have a specific session on for the 3 participating countries with the World Cafe approach to discuss this and pinpoint how we are going to do that. We also not only within the month that is still running for this project that ends at the end of October, but how can we also make sure that this is done beyond the project. Again, as I already said before, if you would have recommendations yourself, please feel free to provide us with that and to see how you could contribute to ensuring that this is getting done. Thank you.
Thank you, Ines. Then there had been some question on where to find the tools. And I see that our colleague Leni has posted this in the chat, because all tools are available on the website of ICRH. So you can find the link in the chat. And then we have another question from Eva Veroli, and I think that's going to be the last question if we look at the time. So her question is, are there some cases in which the relief work with victims of sexual violence is carried out with cultural mediators? Do they make part of the work team? And did you find the role of cultural mediators recognized as such in some of the involved countries? Because she thinks this is crucial to succeed in this socio-educational work. So maybe I give the word to Hans to see if he has anything to add to this question. Hans?
Well, we have little experience. There's one intercultural mediator we know who has been working a lot with, or a number of times rather, in Brussels with victims of sexual violence. But normally intercultural mediation is not available in these centers. It's only in Saint-Pierre Hospital, I think, that they are every now and then called in. And we have little data on what they did exactly, but we will look into it in the future.
Okay, thank you, Hans. So I think with this, we came to the last question in this Q&A session. So thank you, everybody, for your feedback and your questions, plural. Then I propose we go into the break. So we foresee to come back into this session at 20 past 11. So enjoy a cup of tea or coffee and see you in a bit.
All right, welcome back to the seminar. I hope you had a nice tea or coffee, or you still have it at hand. We will continue with introducing you the safe reporting framework for migrants, and this will be presented by our colleague Nicolette Salé. Nicolette is a postdoctoral researcher at Ghent University at the Center of Social Studies on migration and refugees, and her main interests are diversity and inclusion related to migration, multilingualism, and education. And in the INHeRE project, she has been working on understanding policies and practices of safe reporting for migrant victims of sexual violence. And together with the other colleague Anne Verhaels, they led the development and validation of the INHeRE safe reporting framework. Dear Nicolette, the floor is yours.
Thank you very much. I will just share my screen very briefly. Yes. Does everyone see my screen now?
We see you, but we don't see the screen yet. It's coming, it's there. Please go ahead.
Perfect. Okay, so I'm going to talk today a little bit about the safe reporting framework for migrant victims of sexual violence, which is a work that's been led by myself and Anne Elst, and of course with many partners of the INHeRE Consortium, and especially the Havens in the UK, Department of Justice in Ireland, and PAYOK in Belgium. And here in this tool, we were very much interested in how we can understand safe reporting. What are the main obstacles that migrant victims of sexual violence face in terms of reporting and accessing the care and support that they need, as well as how can we better support professionals in implementing practices that essentially and eventually lead to safe reporting. So, well, I hope it goes on. Yes. So why do we need a safe reporting framework? When we talk about migrant victims of sexual violence, of course, it means and it covers individuals with very different migration statuses. So it can change from having permanent documents, temporary documents, to having documents in the process, for example, when applying for international protection, as well as migrant individuals who are, for any reasons, are undocumented in the country. And so that also means that these sort of different statuses put individuals in different positions, different legal statuses, and that different positions lead to different levels of vulnerability of being able to and feeling safe to report to authorities such as law enforcement. So apart from the obstacles that you've already heard from Sylvia in her excellent previous presentation, what we also like to point out that due to these different legal statuses, migrant victims face additional and very specific barriers in reporting sexual violence. So our research showed that there's a lot of uncertainties around what would happen with victims' migration status if they report. There's a lot of fears around deportation, detention, or other punishment based on migration status. And that's a fear that exists in all migrant victims of sexual violence, regardless what kind of status they have. We've also found that gaps in policies and practices exist that mostly affect undocumented migrants of sexual violence, but equally there's a lot of procedural uncertainties even when rights are provided to all victims of sexual violence. So then, what is really safe reporting then for migrant victims of sexual violence? In INHeRE, we conceptualize this as the possibility for a migrant victim to report sexual violence in safe conditions, having their identity protected both from perpetrators as well as immigration law enforcement. And we draw a lot on the work of PICOM in this regard. So it means the freedom to report crimes without the fear that one will be punished for coming forward, and prioritizing the needs of the victims and seeking justice ahead of enforcement of immigration rules. So this would be a legal guarantee that migrant victims will not be subjected to immigration law enforcement, such as deportation, detention, and other types of punishment which are based on migration status when or as a consequence of reporting sexual violence. So this includes all victims of sexual violence, including undocumented migrants, to feel safe at every step of their journey to report. In our work, it became very evident that reporting and safe reporting does not only refer to the moment of reporting, as there are several steps are made on the journey to arrive to the moment of reporting, and that a lot of steps should be made more safe in order to eventually arrive to reporting. So in our work, we take a view on safe reporting as a continuum. And so very importantly, safe does not only refer to a feeling. We hear safe, feeling safe, being safe, and so on as a sort of elusive concept. And in this work, we both emphasize the need for individuals to feel safe, to have a safe environment, a safe reception, and so on. But it does not only refer to a feeling of safety, it refers also to exercising rights of accessing justice, support, and the services free from judgment, discrimination, and disadvantage. So the purpose of the safe reporting framework is to assist professionals to better conceptualize and implement practices of safe reporting, which is inclusive to all migrant victims of sexual violence. It provides a holistic approach, and I'm going to talk about it later. It has an overarching umbrella concept on what to focus on. And then the actual tool that I'm going to present later on, and that you might be able to read very soon, it also consists of examples of best practices based on the situations in sexual assault care centers and with law enforcement. Some of the practices and the scenarios that we present in this framework already exist in some countries, and others are not yet in practice, but that we propose them as best practices based on the extensive research and 2 rounds of validation with victims, sexual assault care center staff, and law enforcement that we've done in this INHeRE project. So just like the development of the triage tool, if you remember it, this safe reporting framework was also results of a long process based on participation of very different stakeholders and a stepwise approach to better understanding safe reporting. So first, we conducted a desk research and stakeholder consultations on policies and on sexual assault care centers practices in Belgium, Ireland, and the UK. And based on that, we developed an initial safe reporting framework. Then this framework was validated in a first validation study in focus groups with victims, sexual assault care center staff, and law enforcement. Based on the outcomes of this study, and then in collaboration with the Havens in the UK, we've fielded and tested specific scenarios in sexual assault care centers where we identified key processes or moments which are really vital for providing safety, and then the journey to safe reporting. And then we tested that in a video assessment, again with the same groups. And then so finally we adopted, refined, and then finalized the safe reporting framework. And that's you're going to see very shortly. The policy mapping that we done in the first step, you can already access and download for free, and keep an eye for the safe reporting framework. So what is it? What is the safe reporting framework? During our research, we found that there are 3 main building blocks that we advise to professionals, authorities, and other agencies to use when thinking about safe reporting. And one is a legal framework for safe reporting that needs to be done and needs to be put in practice in order to provide safety, also in legal terms. Second is procedures for safe reporting, and here we particularly looked at sexual assault care centers. So this would mean the processes, the interactions, the way things are done in sexual assault care centers to provide safety. And thirdly, and very importantly, the victim-centered and trauma-informed approaches of professionals, of any professional who come in contact with migrant victims of sexual violence. We present these 3 building blocks as separate, but in reality, and what we found also during the testing, is that these 3 elements come together in a very entwined way in real life. And so it's very important to have all 3 in minds of professionals. So first of all, the legal framework for safe reporting would need a law or legislative framework that delinks reporting sexual violence from immigration law enforcement. And it ensures that victims who come forward are not subject to immigration law enforcement. As I talked about this before, deportation, detention, or other punishment based on not having the right documents that would be needed at that point in a certain country. So such a framework would establish a firewall. EU law and policy should then ensure that any immigration enforcement should only be applied without prejudice to the Victims Directive. And of course, we importantly acknowledge that this is a framework that should be worked out and embedded in the national context and would be complementary to national legislation. This provides the legal base for the right to safely report for all migrant victims of sexual violence at all stages of the case. So it means before reporting, the moment of reporting, during the criminal proceedings, as well as when a case is closed. This legal base would provide the base for further policy development, as well as for implementation in practice. In our research, this legal guarantee was really important for victims of sexual violence, as well as professionals who felt that without a legal guarantee, also their own capabilities of providing safety on or insurance on certain issues were limited. But equally, all stakeholders pointed out that a legal change is not sufficient in itself, and that major issues exist in terms of awareness raising. So knowing about rights, knowing about services, knowing about safety. In some countries, already existing safe practices are not known about, and therefore awareness raising about rights, about access is equally important. Secondly, in this safe reporting framework, we talk about the procedures, so the way things are done, procedures, processes that make victims feel safe to step forward to report sexual violence, as well as to enter a sexual assault care center and seek support. These procedures would comply with and ensure the implementation of the legal framework for safe reporting. And in our framework, we specifically looked at 5 key processes or key procedures that the stakeholders found essential. First of all, just as in the legal framework, awareness raising about the services that are available for migrant victims of sexual violence. As generally, it seems like that communities, victims themselves rarely know about their rights and their opportunity to access care. And therefore, they suggested a lot more focused, multilingual, community-based, and done on very diverse platforms. For example, leaflets, social media, public places to advertise and raise awareness for migrant victims of sexual violence, that they can indeed access safely these services. Secondly, the way information on services, procedures, and victim rights are provided for victims were very important. Clear communication, multilingual information, multimodal representation of information, as well as checking on the victims if they understood, being open to questions, and having a step-by-step approach was found important. Data management and data sharing, again, was very important. So issues around confidentiality, assuring victims around confidentiality, the protection of their data, giving them the opportunities and options of how data can be shared, seeking consent in case data is shared with other agencies, and so on. Individual needs assessment and protection was utmost importance for migrant victims of sexual violence, to such an extent that if this was not provided, then some victims would not seek help or would not report at all, wouldn't even consider, especially in terms of safe accommodation. And then providing information about reporting and criminal proceedings prior to the moment of reporting was also important, through informal channels, communication with law enforcement, as well as other reliable actors where migrant victims could get information about reporting. The full set of recommendations I'm not presenting today, so these are only the building blocks. And when we publish the safe reporting framework, there you can find the building blocks, as well as all the recommendations and the specific scenarios. So today I'm just summing up these points for you. And then thirdly, professionals' interrelational professional attitudes and behaviors that are victim-centered and trauma-informed were really important, especially for victims. In our focus groups, victims that or dedicated a special emphasis to this, even over the existence of a legal framework or of understanding a certain procedure. This came out as essentially important for victims. And what does that mean? It means that professionals have certain attitudes and approaches that help victims feel safe, welcomed, understood, believed, and supported. First, it includes a clear communication. So informations that professionals provide to victims are clearly formulated in a simple language as well as multilingual if needed. That professionals take steps to establish trust and reassure victims that they are safe, they are protected, that procedures are confidential, consents are sought if needed. Choice and control was equally important for victims. So apart from having an overview of what kind of services they can access and understand that clearly, the choice that they had to choose and that their decision was respected by professionals was equally important. Flexibility and patience of the procedures and an attitude of professionals of being patient with an individual who might go through traumatic experiences, give time for decision making, give time for processing certain information was very important. And it also played a role in gaining trust. When professionals were flexible to the needs of victims and gave the time enough to process, it also contributed to feeling safer and trusting more the professional. And finally, empathy and dignity was, of course, very important for all victims of sexual violence, so that professionals treat them as human beings with empathy, with dignity, believe them that they are not judged and that they don't feel stigmatized in that role. So that's it about safe reporting framework, and I will be looking forward to talking to you about this in the QA later on.
Thank you, Nicolette. For all the participants, we will now first give the floor to Raquel Correa, who will talk about all the trainings that we did, the massive open online courses, but also the training of trainers. And then after that, when Raquel has presented all of that, we will have the possibility again for questions and answers. So Raquel Correa is an experienced consultant clinical psychologist working for King's College Hospital, where she heads the Havens Therapies Service. And the Havens is a London-based sexual assault referral center. She has collaborated in several streams of the INHeRE project, with particular focus on the evidence-based psychological treatment module, the training of trainers of psychologists, and the trauma-informed guidelines and the triage tool. Please, Raquel, the floor is yours.
Thank you so much, Ines. So I hope you can all see my my screen.
Yes, we do.
Great, good. So this is really going to be a whistle-stop tool in terms of training of professionals, which is one of the work streams of the INHeRE project. I'm going to be talking about the work that we have done in terms of this work stream, but as has already been said, we welcome recommendations in terms of continuing to cascade knowledge, far and wide. So with regards to the training of professionals, the main aim, we have our overarching aim in terms of the INHeRE project, which is to improve holistic and inclusive care for MAR victims of sexual violence, regardless of their age, gender, sexual orientation, and or legal status. However, the training of professionals in particular has as an objective to build capacity and enhance the culturally diversity competent practices of key professional groups. So this was really, really important for the project. And how did we go about doing this? So we took like a two-pronged approach where we developed 2 core trainings, tools and activities. One of them has been referred to this morning, was the massive open online course. So e-learning modules that were holistic, with a holistic curriculum that are available in Dutch, French, Italian and English. And the other approach was through training other professionals. So this was achieved by multi-day training sessions of 4 key professional groups. In the groups we targeted were psychologists, asylum services staff, interpreters, and intercultural mediators, and law enforcement. So we'll tell you a bit about the MOOCs. So what did we want to achieve with the MOOCs? So the MOOCs were developed with input from experts from a wide range of sectors. We wanted the e-learning to be holistic and inclusive, to be accessible to all. Also self-directed learning. So participants could choose when to go through the modules, with a high degree of interactivity with quizzes, also assessments in terms of knowledge, and learner-initiated navigation. We wanted to make sure that it was relevant across disciplines, but also to have modules that could stand alone. For example, the module number 8 is in particular for psychologists and very specific in terms of evidence-based assessment, formulation and treatment of clients presenting with trauma as a result of sexual violence within the context of migration. We also wanted a user-friendly interface that would be inviting for those new to e-learning, and also to be evidence-based, to look at evidence-based change in knowledge, attitudes, and confidence in professional practice. So here are the 8 modules that are now available, and these 8 modules covered key topics and technical skills relating to sexual violence in the context of migration, and they are now available and open to all. As you can see, there was a wide range of topics for each module. We evaluated the modules because we wanted to make sure that we got it right for participants. And what's really important to pilot the MOOCs and receive feedback, and then go back and look at the material again and change or amend to make sure that it was meeting, the objective that we really wanted. So the modules were piloted by professionals over 3 months. We also evaluated efficacy of the e-modules using a knowledge, attitudes, and practices survey. The CAP survey was administered at 3 time points, right at the start of the modules, after 3 months, and after 6 months. initially, there was a lot of interest in signing up to the modules. So you can see that we had approximately 870 people who were interested in participating in the pilot, but we did have kind of high attrition up to kind of the moment where we had participants completing all the mandatory modules of the e-learning course and completing also the second CAP survey. And I think partly is kind of, we need to remember that we were piloting in the heat of the pandemic, really, and there was quite a lot of fatigue, Zoom fatigue. So being online was quite an ask, perhaps for some of our participants. So here we can look at the professionals that participated or completed the MOOCs. Not surprising, the majority of staff working in this particular field tends to be female. So we had 86% of our participants were female and 14% were male. And also kind of the majority of participants were from the INHeRE partner countries. So United Kingdom, Belgium, and Ireland. But we also had participants from other EU countries, namely Spain, Denmark, Italy, the Netherlands, France, Germany, Greece, and Sweden. So here you can see in terms of the professional groups that participated in the MOOCs. So it was quite a reasonably kind of good range in terms of representation of different professionals. It's also was important for us to look at, are the e-learning modules really having an impact? And what we found when we did the CAP survey, and we did some statistical analyses, we did find that in terms of knowledge, before completion of the modules and after completion of modules, there was an increase in knowledge. And this increase was found to be statistically significant, as you can see. And the same applies for the attitude. We did find that attitudes shifted before completion of the modules and after completion of the modules, with the results, again, showing being statistically significant. In terms of the evolution in attitudes, we found this was moderated by the strengths of belief. So kind of the stronger the belief, the harder was to change attitudes, as you can see in the graph. Here we have some feedback from participants that participated in the pilot of the MOOCs, and we received largely positive feedback from professionals, really describing that they gain kind of broader and more holistic knowledge base. I won't read all of the codes, but you can see kind of the first codes. So big thanks for creating this course and making it available for workers. I often found myself reflecting during my work at some aspects mentioned in the course. It helped me with some patience. Also, kind of the last quote, this is a very useful course. As an interpreter, I would recommend it to all my colleagues, regardless the language or culture, as such issues may not be limited to just refugees and migrants, but are very relevant in human trafficking too. And that can happen within the society. So really important, kind of, you can see already kind of generalization of the learning and thinking about how the knowledge that was acquired or perhaps developed further through attending or through completing the MOOCs, how they can use in their day-to-day work, kind of with also other populations. So kind of the MOOCs were revised, as I mentioned, based on user feedback. The translation was completed with the support from the INHeRE Consortium, and they are available in 4 languages. As my colleague Leni mentioned at the beginning, I believe the Italian version is still being worked at. Hopefully will be made available soon. And the modules are available through the Ghent University's e-learning platform, and you can see the infographic on the right-hand side of the screen. And the preliminary kind of analysis of the 6 months CAP survey is underway. So we are still kind of, doing work, but what we have found is that early findings, preliminary findings, indicate that knowledge decreases marginally over time, but remains higher than at baseline with no significant change in attitude. I think this is really crucial, kind of to bring your attention to this, kind of in terms of knowledge decreasing over time, even though knowledge is much better than what it was at baseline. But this just really shows us that attending a one-off training is not enough. And it's important to review materials, to do CPD, or just kind of refreshing doing some of the modules again. So moving on, now kind of we looked at the first prongs approach, which was the MOOCs, and now we're going to talk about the training of trainers that we developed and delivered. So the training of trainers was in-depth in-person training, and the sessions were spread over 4 days, and the decision was made to spread the sessions over 4 days because some of the trainings took place face-to-face but online, and we were very aware of Zoom fatigue, and we believe that kind of was a good compromise and worked relatively well. What we wanted kind of a multiplier effect where each participant committed to carry out 2 peer training sessions. So our participants signed a memorandum of understanding in that they were aware that they had to cascade the knowledge into training, because what we really want is really kind of to spread the learning and increase capacity in the community through this cascading multiplier effect. So all the participants completed the e-learning modules prior to attending the training of trainers, and we targeted 4 professional groups: psychologists, police and law enforcement, asylum reception and accommodation center professionals, and interpreters and intercultural mediators. And all the 4 trainings were evaluated by the delegates. You can see that we had a fairly balanced participation across the 3 partner countries. So you can see in terms of asylum reception professionals, police and law enforcement, psychologists, interpreters, and intercultural mediators. And the sessions were adapted to each core profession. So all the trainings provided an introduction to sexual violence, migration, the needs of specific groups, holistic care, and kind of impact on professionals in self-care. And then we focus specifically on the needs of each of the professional groups. So thinking about asylum reception professionals, kind of one of the core aspects of the training that was specific to that particular professional group was the identification and referral, and also the use of the triage tool. For police and law enforcement, the specific training for them was around interviewing victims and using the trauma-informed good practice tool in police interviewing, and also addressing challenging situations. For the psychologists, the specific training focus on best practices in psychological assessments of adults as well as children and young people, also treatment plans and therapy, and what psychological outcomes look like in this particular client group. And finally, the training for interpreters and intercultural mediators focused, in addition to the core topics, on the video remote interpreting techniques, the role of interpreters and expectations of care providers. A lot of work went into these specific trainings, and kind of a lot of knowledge and expertise as well was shared with the delegates. Here you can see that most participants report the training met or exceeded their expectations. There were some participants that had commented on having technical difficulties. A couple other participants talked about wanting a particular subject to be explored a little bit further. Sometimes can be difficult to kind of pitch the training at the right level, because sometimes our delegates may have more or less experience. But I think on the whole kind of felt that was kind of, met the expectations. And we have some feedback from our delegates of the training of trainer sessions. Here you can see, for example, the first quote, good trainers, clear, open, knowledgeable, and inclusive, very useful grounding the challenges of working with this population from the individual to the systemic level. Hearing the feedback from the users of the interpreter services and their expectations on what we provide was very interesting. So was overall kind of, really, again, very positive feedback that we received in this particular work stream of the project. And that's me.
Okay, thank you, Raquel, and also Nicolette for your presentations. So we have 20 minutes now again for questions and answers. So I'd like to invite everybody to put your questions in the Q&A, and then I can direct them to the potential person who could, to the person who could potentially answer your question. I think for the trainings itself, Leni had already previously put in the chat where you can find access to the massive online course, which will be openly available from tonight onwards, if I understood well. Yes. Okay. Were there any questions on the safe reporting procedure as was presented by Nicolette, or on the more specifically on the online course? There is somebody who asks, would you be able to send a link to the MOOC course? I struggle to access it with the info provided. I would be interested in doing the course if it is still running. So maybe Leni, do you want to summarize on where the course can be found and until how long it will still be accessible?
Yes, thank you for your question, and thank you, Sar. Well, as I've said before, the course will be open, and a user guide will be available from tonight onwards, and this will be in French, English, and Dutch. The Italian version will follow later on this week, as the translations are not yet finalized. But from tonight onwards, you'll be able to find a user guide in the form or in the format of an infographic, which can guide you to access these MOOCs, which are running on Euphora, which is the university platform. So I would say have a look at the website again tonight. The website I've sent before in the chat, which is icrhb.org, and then you'll find below the button projects, the INHeRE project, and there you can find all the information, the tools, as well as the user guide to access the MOOCs on Eufora from tonight onwards. I hope that was clear.
Okay, thank you, Leni. So everybody, let's go to the website of the project. Then there is this question from MT Lee who says, if an interpreter sees that, for example, the safe reporting is not observed or not followed, do those interpreters then intervene? Maybe I can ask Hans if he can share his opinion on this question.
I think that's a very tricky situation. I mean, as an interpreter, you're not really in a position to challenge what the professionals are doing. And I think this would be very difficult for an interpreter to do that.
Okay, thank you, Hans. Then there is a question about if there's about the potential for training the tribunal judges in the UK. Lisa says, I don't know if there are any UK law enforcement professionals here, if they have a view of the courts of tribunals. We have difficulties with our tribunal system. So I don't know, Raquel, if you can maybe respond to this question for the UK setting.
We do here in London. We do some work with the CPS, with the Crown Prosecution Service, and trying to bring in psychological evidence into crimes of rape and sexual assault. Not necessarily in terms of this particular project in the work with MAR victims, but just on the whole. I guess there are some difficulties in terms of training, in terms of kind of doing some additional training. However, I do know that Crown Prosecution Service colleagues are receiving training on trauma, and ourselves in the Havens have provided that training. So I'm aware there is training happening for prosecutors. I don't know if that kind of answers the questions, but I do agree there's a long way to go because you know, when we think about psychological evidence, you know, it's kind of it's still a very low profile, and I think we are working on it, but I think it may take some time for practices to change.
Okay, thank you, Raquel. And then I think I also have a further question for you, Raquel, on training. There's a question here from Patricia Foster, who asks if there will be future training of trainer opportunities, and if so, if they would include cross-training between different professional categories involved.
We are not planning at this point in time to deliver more training of trainers, but in saying that doesn't mean that we won't be providing them. And I guess kind of is something that we're going to be continuing to discuss over the coming days with our partners in terms of the next steps and how to take this forward in terms of all the tools that came out of the project. But I guess in meantime, you know, it's really important if you haven't done the MOOCs, or if you have done the MOOCs but would like a refresher, I think they provide really good knowledge. And kind of it also varies in terms of the professionals. Yeah, I'm sorry, just looking at a message that just popped up. So we have done training in UK, for example, to psychologists, and also Hans provided the intercultural mediator in interpreters training. So kind of different professionals leading the project have provided the training, and the delegates who attended the training will deliver training because that was part of the memorandum of understanding that they have to provide trainings to other professionals. Obviously, it is a drop in the ocean. and kind of we'll continue to think about how to really expand the knowledge, skills, and capacity within the community. But the short answer is that we don't have any training plans just now, but that doesn't mean that we may not deliver the training. And perhaps we could do some bespoke training potentially in the future, where we could provide a half-day training or full-day training. That's something certainly to be considered, and we very much welcome any recommendations you may have in terms of how to take it forward. And just because the question was answered, I can see there's an appetite for more training, and it's something we need to think about in terms of resourcing and delivering it, and how to go about it. Yeah, thank you.
I'd like to add something to that. I think the idea, which was brought to the fore by Patricia Foster, is also that we could maybe train different groups together. And this is something that came very much out of the interviews we did with care providers, that they said, well, we've never had any training to work with interpreters or intercultural mediators and vice versa, and we don't know what to expect from each other. And I think this is something we might consider in the future, that people could be trained together to work in the best possible way together.
Okay, thank you, Hans and Raquel. I see also multiple questions on could this training, does it exist in shorter version for specific public like foster carers, etc. So I think my colleagues have already partially answered this, and that the training course as such is shared, but that within the project there will not be any shorter trainings provided or adapted. Okay, then I think I don't see any other questions. There was still a question from Pascal Rilov on who to get in touch with to adapt the training for public service interpreters in Flanders and Brussels. So I think Hans is the best person to get in touch with to discuss this. Then I am looking if there's any other questions. And then somebody is suggesting to convince interpreters, associations, or translators that the training is useful. Well, I think we're hoping that everybody who participates in the seminar today will also be able to do some word-to-mouth publicity for the tools that we developed and that are available. So indeed, the more people who use them, the better, of course, to ensure that we achieve this the purposes of the goals of our project. I don't see any other questions so far. So if there's no additional questions, I think I can give the word back to Ines.
Thank you, Saar. But there was also somebody who said training magistrates. Klaus is very important, as that question was raised for the UK of training magistrates, but largely dependent on the national systems and connections between victim organizations, police and magistrates. But that's something that we can still come back to as well in the law enforcement more broadly. It's not, of course, only on police, it's also other people involved in the justice departments that could benefit from this training. That's something that we really recommend to do, so that they are also aware of the MOOCs and that they can follow. That's something that is already done in Belgium now. I think our Flemish Minister of Justice also invited or stimulated lawyers and magistrates, and also at federal level, to follow courses compulsory now, even on sexual violence. So in Belgium, this is already moving quickly, well, or slowly. we are getting there, but it's definitely something that would be recommended in other countries as well. There is still There are some questions. I will give the floor back to Sari first, because they are popping up now.
Yes, well, I see Stella is asking if her question had been responded. I'm sorry, Stella, I thought that question had been addressed by Hans already. So it was the question if interpreters, cultural mediators that participated in this course, if there would be a possibility to get to know ourselves in order to have an exchange, professional experience for those already working with this project. I don't know, Hans, if you want to expand on that.
The question is not completely clear to me, Sar. Could you repeat it?
Sorry, Hans, you wanted me to repeat the question?
Yes, yes.
Yes. So the question is if it was to know if it would be possible for the interpreters, cultural mediators that participated in this course to know ourselves or to get to know one another in order to have an exchange of professional experiences from those already working with this project.
Well, I think so. They could get in touch with us and we could ask those who participated in the project whether they agreed to be brought in touch with the person who raised the question. Certainly, yes.
Okay, thank you, Hans. Okay, if I'm not mistaken, I don't think there's any other outstanding questions now that have not yet been addressed. So, Ines, back to you.
Thank you. I think Leni will share her screen because we would like to ask you some questions now. We have several ideas of policy recommendations that we would like to make, not only for policy, but also for practice. But we would very much like to hear your opinion on that. So, Leni, can you go to the next slide, please? So, we would like to invite you to go to www.menti.com. So you can take your smartphone or do it by mail as well, but it's a bit easier if you have a smartphone. And then if you go on menti.com, you will be invited to enter a code. And this is the code that you should enter, 72744826. And if all goes well, you'll be prompted to answer some questions. Leni, could we already see? Yeah. So our first question is, which channels would you suggest to implement the project tools and trainings in the 3 partner countries? So which channels do you think we should try to tap upon to be able to increase the implementation possibilities in Belgium, UK, and Ireland? So the code you can see on top of the screen is 72744826. Yes, by channels we mean what of communication strategies or leverages or other communication channels, whether it's a newsletter, do we need to make a radio spot, should we have policy briefs, all ways of communication. So several people already Okay, maybe I have to stop scroll. Thank you. So already a lot of people have provided us with some suggestions. You can still continue. I think what several people have suggested now is to go with a multi-pronged approach. First of all, bottom up, to work with organizations of representatives of survivors of sexual violence, also other types of organizations that are first line working with MARS, whether they're already a victim or not. Then several other suggestions were made to provide both online trainings, e-learnings, and also face-to-face trainings, but that this is also a bit monitored or provided or at least indicated at websites of, for example, governments and official organizations and institutes. Then several people also said that through the organizations they are working, they get like newsletters, internet, intranet, other types of information that are specific to their professions. That it would be good that, and several people indicated some projects or organizations and websites that could be addressed to us to put our MOOCs or to refer to our MOOCs and all the tools we made. So we will try to get in contact with these organizations. Many thanks for that. Some other people also pointed out, and that's something being part and professor of a university, something it's what is at my heart very much, is that it should be a mandatory training part of all the key professionals that we are addressing here, that this is so self-evident that this should be part of their basic curricula before they start working in the fields that these tools, but also trainings should be part of them. Then some other people also suggested to do more general awareness raising of the problem and potential solutions. So also the tools and MOOCs that we developed in schools, through media, in other other public and social media. And then also some people suggested to work more closely with policymakers and try to influence them. And somebody also said to try to find some friendly parliamentarians. I think as such, most of the parliamentarians are friendly if they are also keen to take up the goals we want to fight for. That's of course not for everybody, but we are certainly, and I think that's also why we had our the EC officer this morning, and she said about the network, we certainly will get in touch with Christa Jacobson again to see how we can also at European level, but also at national level, make sure that we write also policy briefs and that they that we stay in contact, in close contact with policy members to get this moving forward and implemented. And then somebody also said to have regular Zoom meetings such as these, including quarterly or yearly email updates. I think that's a good suggestion. Of course, it is not that easy to implement beyond a project cycle, but it's definitely a suggestion we can take forward and think about how this could be done. And maybe it's also something that could be a suggestion to the EC officer with that network would be installed. And then other NGOs have also been suggested. So please continue adding suggestions there. We will definitely compile all of that. But maybe we could already go to the second question then, Lily. No. So are there other communication channels or other ways you see that we could address to get the implementation of our project tools and trainings done in other European countries? beyond Belgium, UK and Ireland, the project countries so far. So disseminating it more largely than those 3 countries. Somebody already suggested European Network of National Rapporteurs. Yes, ECRE. The European Civil Society Platforms for Victims. The European Network for Public Service Interpretation and Translation. The International Federation of Translators, the European Federation of Psychologists, EFPA, who was luckily one of our experts in the expert panel. Really, could you screen a bit? Through EGE and Eurostat, for police, CIPO, UNHCR and UNICEF, the European Council as such. I think normally our project should also come on a database of the European Commission and of projects that are closed. Other people are suggesting to use through universities and graduate schools. Also other networks that are more related to specific professionals, NGOs. To the COST network on health and social service for migrants and ethnic minority. Yes. The Directorate for Interpretation of the European Commission and their digital platform. And also be present on huge spots like Lesbos, Calais. Then I think that's immediately the implementation itself, wherever we can be to provide direct care to victims that maybe have not found yet their way through the sexual assault care centers. So there will be frontline work to do there. And also to align with the UN Sustainable Development Goals. I think we tried to do that in the development itself of the tools, to be also in accordance with the Leave No One Behind and the Sustainable Development Goals there. Europol, international conferences. Yes, I think Europol comes back several times. There was also, as in the previous Q&A, there was a question raised about the magistrates and the prosecutors. How could we get them informed at more European level? Are there suggestions there? I think at health aspect, WHO. In the beginning this morning, when I was doing the introduction, I had a lot of trouble with the computers here, so some slides were gone, but ICRH is also a WHO collaborating center on sexual and gender-based violence. So we are in direct line with WHO on these topics. So we certainly will post this information in our tools and make them known to WHO. Trauma Response Network, EMDR Association. I think that can be done in several countries. That's a very good suggestion. Eurojust, okay. All right. A lot of suggestions there. Thank you. We will compile all of your suggestions for the implementations on European countries. If you yourself would want to set up a follow-up project in other countries where you would want to implement what we have done, please feel free and also contact us to see if there would be a possibility of collaborating or what other assistance you could seek from us. It would be a pity that at the end of this project it is not taken further, because we definitely have seen that although we managed to provide already a lot of tools what regards the safe reporting and how to get this implemented, now assuring that the situation is changing for the victims in all our European countries. We still will need a lot of follow-up projects and also to evaluate them. Okay, EU wards in hospitals, emergency wards. Yes. Okay, thank you very much. Then we will go to the third question. So we had our 5 key professionals, and several people during the course in which we were implementing this project contacted us to know whether they could also use the tools that we developed, or the people participating in the MOOCs or in the training of trainers also said, but maybe that's not only interesting to me in this type of profession, I think that other colleagues or other professions could also benefit from using the tools. So which other type of professionals do you see that could benefit of the MOOCs? If you want to be specific for 1, 2, then you can add that too. Guardians, social care workers, the migrants themselves. Yeah, I think to be a bit more broader, I think general awareness raising on what sexual violence entails and what the impact is or could be of on people's lives, and that it's important to seek the right care, that it will help to recover, is certainly something that could be done. Teachers and social workers, yes, and different organizations, all healthcare professionals. So this should be in the baseline curricula. Religious groups, the OCMW first line, so the social services from the cities and communities, who are also in Belgium normally responsible for housing of, or at least in addition to FedAsyl and other organizations, to housing applicants of international protection and refugees, and social sector teachers, local councils. Yes, then we have the city level again, local government, service providers for housing departments, adoption and fostering service, debt advisors, tutors or guardians of non-accompanied minors. Yes, so then it comes back at the religious groups that we already have. So the types of organizations that are more leisure or religion or community oriented, as for example, Sunday schools, doctors, street workers, yes, NBC staff and lawyers, immigration solicitors. I think, yeah, what this is a bit also referring to what one of the questions in the Q&A. If offenders are being convicted, that's already a good thing. But if in the end an asylum claim is not accepted, I think in our ICAP in Belgium, so in our Implementation and Community Advisory Board in Belgium, the people of the Foreign Affairs already mentioned that they would be very interested to use this also, so that they could also do better interviewing in order to have a better decision making on whether an asylum claim can be accepted or not. So that's definitely another avenue. More in healthcare, doctors, general practitioners, psychiatrists, general child and youth workers, addiction and homeless services, immediate emergency room receptionists, border force, home office, caseworkers, home office and lawyers. Okay, so that's more in the law enforcement part. And then several people suggest to also do general awareness raising. I think we in our MOOCs also addressed the ideal victim theory, and that a lot of migrants do not fit the myth that victim is mostly female, young, and attacked by somebody unknown. And a lot of migrants who became victimized do not fit that image. So they are also often not seen as a credible source of information, what makes a lot of people difficult to understand or acknowledge that migrants have been victimized and have also the same right to care as any other victim. Okay, organizations with migrant women in Belgium, like GAMS, Women Do, Frontline police officers and their supervisors, prison guards. Okay, sex worker outreach services and sexual health clinics. Right, I think that's already very broad. That aligns also well with the input we got on the other questions we have. We will take this further, also discuss in our consortium and also with our expert panel what we could do with this information. If you yourself would be interested to contribute to this implementation in your own country or abroad, it would also be nice if you could let us know. So we can also see if we can stay in contact and see how we can take this further. This afternoon, we have a specific session more closed to work with not only with your policy recommendations, but also what recommendations we should specifically try to split up to make it more tangible, to have specific strategies. So thank you for this input. We will definitely use it, tap upon it, and try to take it forward with the full consortium. So I think also on behalf of the full consortium of the INHeRE project, I would like to thank you for your participation in this short seminar. We just try to be brief, so not to take you away from your other very important work, but we hope that we managed to convey the message that migrant victims of sexual violence are very vulnerable and but also are in big need of good and optimal care for the sexual victimization that they had to encounter. So wherever you are in the pathway of seeing people that you could detect signs and signals that they have been victimized, please use our triage tool so you can better be supported in what you could do. If you can refer those people to the victim, if you can refer victims to sexual assault care centers or other organizations, then within the care centers themselves, that they are now well trained or can still be trained, that we also have the MOOCs. These are open to anybody, but also the other frameworks that we develop more specifically for policymakers, the safe reporting, and also, of course, those trauma-informed guidelines for police. So wherever you are in the spectrum of being in touch with migrants and taking care of them if they have been victimized, we hope that you got a bit informed of what our project could do to provide better care for that. So I wish to thank also the full consortium and all members of the expert panel to have been working so collaboratively and so fruitfully together over the past 2 years, and of course also to the EC for providing us the funding for this project. So many thanks. We hope to stay in contact with you, and for now I wish you a nice and good lunch break. Thank you very much. Mm-hmm.